What's going on, everyone? Happy Saturday. Hopefully everyone is doing well, staying safe, healthy, having a great day so far, and testing negative for the viruses. It is time now for the Saturday edition of the Virus Update for Saturday, August 2nd, 2025. If you're new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Let's face it, there's a lot of different viruses out there, and you need to be informed of what's going on with these viruses. That's what I do here on my channel each and every day. I give you the latest news and data, really anything I can find to help keep you safe and informed. We are in the middle of a COVID surge right now, which means now more than ever, you need to be informed of what's going on. Want to stay informed? Subscribe down below. Give this video a thumbs up. Hit that notification bell. Share this video with anyone you know. And of course, leave your comments down below. I will be working to catch up on the comments later on today. Already, we do have a few news stories to talk about. Then we do have some of our daily things to take a look at. And of course, we do have some new numbers from CJS on these weekly COVID counts here in the United States and emergency department visits. Yeah, things are not going well here in the United States. Starting off with this from CID or AP. They put quick takes. U.S. COVID uptick. New polio cases in 4 countries. There's a virus we haven't talked about in a while. And measles outbreak in Michigan. Starting off with this, COVID activity is picking up in the United States, according to the latest update from the Centers for Disease Control and Prevention. Although wastewater levels are low nationally, the CDC said cases are rising in many Mid-Atlantic, Southeastern, Southern, and West Coast states, according to the CDC data tracker. The test positivity for the week ending July 26 rose up to 6.5%. So out of all the people that went to take a COVID test, 6.5% of them did end up positive, and that's up from 4.9% the previous week. While the rate of COVID-related emergency department visits for all ages combined went from 0.6% to 0.7%. The percentage of U.S. deaths from COVID rose. Yeah, that actually went up this week from 0.3% to 0.4%. Seasonal flu, RSV activity remain low at this time. It is summertime, so we don't expect a big flu or RSV outbreak at this time of the year. But COVID, yeah, we're becoming accustomed to these summer surges. Hey, 4 new polio cases were reported this week. I'm only seeing 3 other countries listed: Yemen, Nigeria, and Ethiopia. So yes, 4 countries, I should say, not 4 cases. Looks like Nigeria maybe had 5 cases. So yeah, that's still a problem. Then of course we have Michigan, which had those 5 cases of measles reported in Osceola County, Michigan. The total number of measles cases this year in Michigan is now up to 27. Yeah, that's relatively concerning. Moving on to this from Dennis the COVID Info Guy. West Australia COVID update week ending on July 27th, 2025. The COVID positivity rate is 4.8%, or down by 0.2%. Hey, that's good. PCR cases, 369. Now, that did go up slightly to 10.1%. Maybe more people got tested this week. Hospitalized decreased to an average of 97 per day. That's down by 3%. In the ICU, a 7-day average increased to 5, which is actually up by 25%. Then taking a look at the ACT weekly surveillance report for July up to July 31st, 2025, COVID is 55 new cases. That is down by 11.2%. Influenza, 393 cases. That is up by 3.4%. RSV, 155 cases. That is down by 8.2%. So there's a little bit about Australia at this time. Remember the other day, Josh Grad tested positive for COVID? Already he has tested negative. Hey, guess who replaced him? John Stamos. Yeah, you remember John Stamos. Full House back in the 90s. You know, Uncle Jesse. Yeah, well, he was the one that took his place. But get this. Josh Grad is now negative. Apparently he was on Paxlovid, and Paxlovid did its thing, but I expressed caution. Back when I had COVID, I had Paxlovid, and guess what ended up happening? A few days later, I once again tested positive. It can happen for those who take Paxlovid. And COVID hits everyone different. Some people don't rebound after COVID. Some people don't test positive again. It's really strange how some do and some don't. All right, back to measles for a second. Colorado health officials confirmed measles case in out-of-state resident. Health officials confirmed a measles exposure at a Monarch Mountain gift shop. So obviously this is not a good thing, and it looks like the exposure was on Friday, July 25th from 4:30 p.m. to 7 p.m. So obviously this is something that we're going to have to continue to keep an eye on, because one case can lead to another case, and we've seen this already happen several times this year. North Carolina reports 5-year high in heat-related illnesses during first half of summer. Yikes, this is not good. And, of course, we've been seeing this happen in many different places. And get this, they reported on Friday that there were more than 3,300 between May 1st and July 12th. In comparison, there was an average of 1,675 heat-related illness emergency department visits in the same period from 2020 to 2024. Yikes, that is a huge increase. All right, taking a look at the viral activity levels in Canada. COVID-19 is low, flu A is low, flu B is low, and RSV is low at this time. We will revisit the UK again tomorrow, and with that we will take a look at some of the other viruses, not just COVID there. We'll do that on the Sunday virus update. Taking a look at what's going on here with air qualities in the United States, and yeah, take a look. The reds, they go all the way down to Oklahoma still, some oranges to the east, even in Kentucky, Tennessee. And then, of course, you get up to Illinois, Indiana, Michigan, Wisconsin, Minnesota, Iowa, Nebraska, North Dakota, South Dakota. You get the idea here. Really bad air qualities. And take a look at this. I got to show you the RAP smoke model. This is a weather model, but it's going to show us where the smoke is projected to go, and watch what happens. It does lift north a little bit, but take a look across the Great Lakes, the Northeast, even Pennsylvania. You do see it does come to the east. So we'll have to keep our eyes on this. I think the Mid-Atlantic, you'll be somewhat okay. The Northeast, on the other hand, like New England, yeah, you're definitely going to be going into the haze as we get into tomorrow and into Monday. You can see it here, clear as day. Will it get all the way down to the surface? Maybe not as much, but again, it's something we're going to need to keep an eye on. For those with breathing problems, yeah, I can raise my hand to that. Yeah, this is not good for you whatsoever. Speaking of not good, Pinellas County, Florida, is been busy, but we're recording today's update early, so because of that, you can see it's not that busy there right now, but remember how busy it's been there in Florida lately. Pinellas County area, we've been seeing all those sick person calls lately. Wait till we get to the data from CJS. It turns out there's a good chance a lot of it may have been COVID related. Taking a look at Philadelphia, 752 EMS incidents reported. Let's take a look at what's going on in Montgomery County, Pennsylvania right now. Mind you, it's 9:30 in the morning. You may hear that's why my voice is a little messed up, because it's still early in the morning. Sometimes when I wake up, the breathing issues pick up. Who knows? It really varies from day to day. Taking a look at this, we can see there is cardiac arrest in Trapp. And let's see, a respiratory emergency in Plymouth. Not a lot of calls right now, but it is relatively early. Taking a look at what's going on in Chester County, Pennsylvania. We do see cardiac arrest there and a respiratory emergency there. Also a diabetic emergency. Taking a look at what's going on in Bucks County. I don't think Bucks County will be busy this early. 5 calls. And we can see, yes, there are a few things going on there as well. All right, taking a look at what's going on with the hospital situation in Pennsylvania, which I got to tell you something. This may be the best. Look at this. Green. Okay, there's a lot of places that don't report. Just one yellow hospital in the entire state. Now, mind you, it's early in the morning, but I think that's about the best we have ever seen, which is interesting because Pennsylvania hospitalizations for COVID are on the rise. Take a look at this. New Jersey. Inspire Center, Mannington, specialty issue. And, hey, that's it for New Jersey. So New Jersey's not doing bad. Taking a look at what happened in New York State yesterday. New York State reported 607 tested positive for COVID. Take a look at this. New York State also reported hospitalizations, 307 and 31 people in the ICU at this time. All right, let's take a look at emergency department visits diagnosed for COVID. We're going to go state by state for this. Then we're going to take a look at some numbers from CJS, and that's going to be it for today's update. And fair warning, this is not going to look good. The United States as a whole, as you know, is rising. Alabama is rising, a little drop at the end, but overall, look at that. That's a pretty big increase. Alaska, maybe leveling off a little bit. Arizona, just a slight rise. Same with Arkansas. It did go down a little bit. Now it may be trying to go back up. California, you're definitely going up. Colorado is going up. Connecticut is going up. Delaware at this time, hard to say there. It looks like it went up, went down. Now it's going back up again. D.C., Washington, D.C., District of Columbia going up. Florida, you're at 2%, and you're still going up. Florida is just doing oh so bad. Georgia's going up. Guam has dropped a little bit. Hawaii is almost at 3%. That's really bad for emergency department visits for people diagnosed with COVID. Idaho's going up. Illinois is going up. Indiana is starting to get worse. Iowa is going upward. Kansas is okay for now. Kentucky is going up. Louisiana is going up. Hey, Louisiana could be the next one to hit 2% as well. Maine is doing okay still. Maryland is going up. Massachusetts is going up. Michigan may be about to go up. Not seeing it going up yet. Mississippi has dropped slightly. Montana is still a little bit low at this time. And Nebraska is going up slightly. Nevada has dropped some. New Hampshire has dropped a little bit. New Jersey is just going up ever so slightly. New Mexico has gone up slightly. New York has gone up slightly. North Carolina is definitely going up. North Dakota is still okay. Ohio is going up. Oregon is going up. Wow, that's actually starting to go straight up. That's not good. Pennsylvania is going up. Rhode Island at this time is okay. South Carolina is starting to go up. South Dakota is going up at this time. And Tennessee is flat. Texas is going up at this time. As a matter of fact, Texas is almost going straight up as well, as is Utah, which is not good. Vermont is still doing fine. Virginia is going up. Washington was flat, and then it went up a little bit at the end. West Virginia, just ever so slight rise. And Wisconsin is starting to go up more. Now let's take a look at some data from CJS. And mind you, there is a lot today, so let's pause and take one of those hydration breaks, shall we? We have forgotten to do the hydration break. I apologize about that, but in this case, you just have to take a hydration break. Alrighty, that feels a little bit better on my voice. Anywho, let's get to some of his numbers. Starting off with Thursday, Florida, the daily number is 19 new deaths, and I should advise you that Florida, the other day they had that big case dump. Now, I didn't add all of his notes here, I just added the numbers, but apparently that case dump they added was not a lie. That was the actual number. Yeah, that means Florida's not doing good whatsoever. New York on Thursday had 625 new cases. Puerto Rico 869 new cases. Arizona, also this is a weekly number now, 932 new cases. Colorado, weekly a test case positivity rate of 7.4%, up from 6.2% last week, and 4 deaths reported by the CDC data tracker. Connecticut, 658, not 3, but 658 new cases. Hawaii, 626 new cases. A test case positivity rate of 12.2%, effectively unchanged from 12.4% 2 weeks ago, but down from 15.1% last week. Something he missed last week. And 6 deaths reported by the CDC data tracker. Indiana reports 574 new cases and 6 deaths reported by the CDC data tracker. Kentucky, 427 new positive tests and 3 deaths reported by the CDC. Minnesota, 477 new cases and 3 new deaths. Nevada, 642 new cases. New Jersey, 693 new cases and 136 CDC reported hospitalizations and 2 deaths reported by the CDC. New Mexico, 228 new cases. North Carolina, 301 hospital visits for COVID-like illness. The CDC reported 130 COVID-related hospitalizations in North Carolina and 10 deaths reported by the CDC data tracker. Now to his Friday numbers. Florida, the daily number, this was a 2-day case update in this case, 3,000 419 new cases and 13 new deaths reported, including one from 2024, 9,901 cases, and, yeah, get this, 69 deaths reported over the past 7 days to go along with, get ready for this number, 1,025 CDC reported hospitalizations. That comes out to a 19.88% increase from last week, and Florida's 1,025 hospitalizations represent 20.95% of what the CDC reported for the nation this week. That is really bad. Florida, come on. You got to take this more serious. New York, daily number, 613 new cases reported today, and 3,625 reported over the past 7 days, a 21.04% increase over last week, to go along with 279 CDC reported hospitalizations and 10 new deaths. Puerto Rico, a daily number, 754 new cases reported today, and 4,516 cases and 12 deaths reported over the past 7 days, to go along with 171 reported hospitalizations. The rest are weekly tallies. You're going to see some more bad numbers here. California, 4,797 new positive tests, a test case positivity rate over the past 7 days of reporting of 8.66%, up from 7.21% last week, and 721 CDC reported hospitalizations, 14.73% of the national count, and 31 new deaths. So get this, just California and Florida. What is that? About 35% of the hospitalizations? That's ridiculous. Georgia, 157 CDC reported hospitalizations and 4 deaths reported by the CDC data tracker. Idaho, 251 emergency department visits and 2 deaths reported. Illinois, 101 CDC reported hospitalizations and 1 death reported. Louisiana, 757 emergency department visits, a test case positivity rate of 9.4%, a slight increase from 9.2% last week, and 2 new deaths. Nebraska, a 9.7% test case positivity rate, more than double the 4.2% rate it reported 5 weeks ago when Nebraska last reported, and 4 deaths were reported by the CDC data tracker. Ohio, 7 deaths reported this week. Oklahoma, a test case positivity rate of 7.6%, up from 6.2% last week, with Tulsa County reported an 18.4% test case positivity rate and 2 deaths reported by the CDC data tracker. Pennsylvania, my state, 189 CDC reported hospitalizations, a 52.14% jump from last week. Yikes, that's really bad because, you know what? We also got hit really hard in the wintertime. Ugh, Pennsylvania, just ridiculous. And 5 deaths reported by the CDC data tracker. West Virginia, 168 new positive tests. Wisconsin, 186 new positive tests, a 4.9% test case positivity rate, up from 4.5% last week. The CDC reports a national test case positivity rate of 6.5%, up from 5.1% last week. 4,892 nationally reported hospitalizations, a 13.69% increase from last week, and the CDC data tracker added 187 deaths since last week and now shows 1,230,481 total COVID deaths since this all started, up from the 1,230,294 it was showing last week at this time. Alrighty, folks, that's some really bad numbers here. The deaths, yeah, they're not really going up yet, but you know what? Take a look at what's happening in Florida and California. They're going to start going up soon, and I hate to say it. I think at some point before this wave comes to a close, which will probably be in September, or at least starts dropping, I think it's safe to say Florida may go over a weekly death total of 100. They've done it before. Here we are in 2025. They have over 1,000 people hospitalized still. That's just really bad in Florida. And I think it's also safe to say, nationally, we will go above 5,000 hospitalizations once again. Alrighty, folks, that does it for the Saturday Virus Update. If you enjoyed today's update, give it a thumbs up. Subscribe down below. Hit that notification bell. Share this video with anyone you know. Of course, leave your comments down below. I am going to be catching up on comments today. I should be all caught up by the end of the day, unless this video really takes off. And of course, if you want to support the channel, there's ways to do that down below. There's Patreon, PayPal, and pretty soon we are going to be doing memberships for these early recorded videos here on the channel, where if I record a video early, you'll be able to see it before it releases to everyone, which I try to aim for between 2 and 5 o'clock in the afternoon on most days. Alrighty, folks, see you again tomorrow. Until I see you again tomorrow, stay safe, everyone, and have a fantastic Saturday afternoon. Thanks for watching.